diving into something so important, survivorship. We're talking about what your oncologist might not be telling you, how Anna is taking care of her bone health now. You're just like in this fog, and then all of a sudden you ring that bell and they're like, okay, now you're good. And you're like, I am? Like, what do you mean? How do I go back? All the things. And I was forced into menopause and then put on an aromatase inhibitor. And at the 2-year mark, when you get the bone density scan, I was thrown into osteoporosis. I want to talk about GLP-1s because everybody in the world is talking about it. So I remember I heard about this on a podcast, actually my girlfriend's podcast. She interviewed Dr. Tina Moore. And I was so intrigued. That is part of survivorship. Women are so alone. They're like, wait a minute, totally dry. I have no desire. It hurts. It's like, how do we navigate that living in this cancer bubble? And I wasn't living. And I feel like there has to be balance to it because you also have to do the things that you enjoy, and they're not perfect.
It truly does just take a little bit of time to get to a place where you can feel a little bit more at peace with what the future may hold.
It really is. The women that have come into my life because of this diagnosis, it's wild. And that is definitely one of my gifts too. Welcome back to Not Today Cancer. I'm so excited for today's guest, Anna Crollman, the incredible woman behind My Cancer Chic. She's been on the podcast before to share her breast cancer story, but today we're diving into something so important, survivorship. We're talking about what your oncologist might not be telling you, how Anna is taking care of her bone health now, her experience with GLP-1 therapy, and even her more powerful tips about how to get through this with your partner and how they can best support you. You're going to walk away with so many insights from this conversation. So let's get into it right away. Anna, I'm so happy you are back.
Me too. I mean, we were just saying, it feels like it was like kind of just yesterday, but then again, life flies by. So
I
I'm
know.
excited we're here having this conversation.
I know. And I think our whole conversation back then, and I will have it in the show notes, but this was several years ago. And I think what we were talking about was the exciting thing. And so I'll share it. We won't dive into all that, but how you can have babies again after going through this. And I think that's what was so powerful and incredible about your story.
Oh my God. I need to go watch it too, because obviously, like you said, we see each other online and, we chit chat, but like that episode was kind of like at a different point in my life and just like different perspective. And so I'm excited for us to dive into survivorship a little bit more, because like you said, that is kind of this space or this phase, this season that I think we live in a lot longer than maybe active treatment or, there's just not as many tools and resources out there for us in this phase.
There's not. I mean, I hear all the time from women who, you get the diagnosis, you power through the treatment, you're just like in this fog, and then all of a sudden you ring that bell and they're like, okay, now you're good. And you're like, I am? Like, what do you mean? How do I go back? All the things. So I'm really excited. So let's briefly share your story a little bit when you went through your diagnosis and all the things, and then we'll dive into the survivorship piece. But just so they have a little background of your
just
story.
like the elevator pitch. I mean, the elevator pitch is, I was diagnosed with breast cancer, stage 2B, when I was 27 years old. I was trying to get pregnant at the time, so fertility was a big piece of my journey. Went through double mastectomy, chemotherapy, 5 years of hormone blocking therapy, and then listen to the other episode for all the details on kind of fertility after cancer, going through those struggles, but then also how I got to my 2 sweet baby boys. And so now I just celebrated 10 years out this summer, which just like, wow, what a milestone. I think that's like just felt so good, but also just a reminder that like, okay, here I continue on in survivorship. So it really wasn't like the big confetti that I was expecting, but I do feel so grateful to be here in this moment and able to continue sharing and advocating as you do. But we also know there's just so much work to be done.
So much. And I just love that you bring hope to others because number one, that you can have babies again after all the craziness, but then also like the 10 years out, that always feels so good to see other people going through it. And they're at this point and you're like, oh my gosh, it just gives you hope. I've always thought like watching somebody ahead of me and seeing them get through it, just, I think gives hope. And that's why I do what I do, just trying to fill the world with hope that life can be good again, different, A little
Different.
different,
Yes.
takes some
Yes.
work, but good. So what do you think?
Yeah.
Let's talk about survivorship and what oncologists don't tell you. Like, you rang that bell, you were finished, and then what?
Gosh, I mean, I think like you, I have so many women reach out, and I think my biggest like thing that I tell people now, particularly caregivers or people that are supporting someone going through cancer, is I just tell them about this phase of survivorship. I remind them that, you know, there is going to be a tough emotional state after the active treatment. And I don't think oncologists are doing a very specific job, right? They are killing the cancer in your body, and for that, we are so grateful. But I think, and this is just a challenge of the healthcare system in general, there is a lack of holistic care. There is a lack of holistic understanding of how, medical treatments are physical treatments, surgeries, of how all of that is going to impact you. And there are so many layers to that that only once you have gotten through maybe your first couple hurdles, maybe you have a mastectomy, maybe you go through chemotherapy, maybe you had radiation. And of course, we both know there's so much nuance to the cancer experience. We're making a broad generalization of treatments. But once you kind of get through these core pieces of your treatment, like you said, it's bye bye. But who's there to unpack it with you? Who's, sitting with you and recognizing, like, wow, you just went through a lot of trauma. How is this impacting your body? How is this impacting you psychologically, emotionally? All of these pieces, I think, are just kind of left to be like, hi, figure it out kind of thing.
Yeah, and the other thing, and you're right, the oncologists, they're doing their specific job. They're trying to eradicate, get rid of cancer forever. So that's their job. They are not a nutritionist. They're
Hmm.
not doing all these other holistic approaches that are so important to add. So I will have somebody say to me, "Oh, well, my oncologist said I shouldn't eat that." And I'm like, "Well, that's not their specialty. Like, that's not what they do."
Yeah.
So I really think it's important, like going to a nutritionist and finding out like updated information on that. So
So true. And I think, it is hard to be like, as the patient, you're the one that has to self advocate and find those resources. But to your point, I think you kind of have to think about survivorship as like, who is my new care team for survivorship? Oncologist was your number one person while you're going through treatment, or maybe it's your surgeon or your radiologist. But like, as you're entering this new phase, this new season, who's going to be on your care team or your board of directors, or who it is you like to turn to. And it should be, like you said, a nutritionist, ideally a PCP, right, a primary care provider, because the oncologist is not going to be able to see you for everything, but you also are going to want care more often. So, at least in my perspective or experience, having a PCP, someone that understands your cancer journey, but can also talk with you about, everyday stuff. I have a cold, I have an ache, I have a pain, and understand that, I think, is so helpful too. What would you add to that, Jen? I mean, definitely the nutritionist, definitely having some kind of primary doctor in your life. Are there other things that you turn to as well?
for sure. And again, I think I always say go slow, one thing at
Yes,
a time. Don't overwhelm yourself. Cause I remember in the beginning being so overwhelmed and I
great
had to
point.
take things at my own pace. But I did get to a point where I was like, I need a functional care. I need a functional doctor.
Yes,
And so that does kind of weed out the nutritionist too, because usually a functional doctor or naturopath, like they have an understanding of it. And then they
good
run
point.
testing. And I think, yes, the PCP, the primary care physician, 100% you need that. But then the naturopath or functional doctor, they can suggest testing to get done. Unfortunately, it's not paid by insurance most of the
Yeah.
time. Although I will say, I've had a couple people in my community and that I've had on podcasts where there's holistic cares attached now to their hospital.
Yes,
So it is becoming a new thing, which is incredible. Like
which
one
is
girl,
so exciting.
yeah, like she gets acupuncture. It's included in on insurance and other things. I'm like, are you kidding me? Like I paid. I was the type of person, I was so scared in the beginning and I was like, okay, let's do all the things.
Yeah.
Energy healing, acupuncture, like, but all that's so
Literally try
expensive.
anything.
Yeah.
It
So
is.
when it came to the naturopath, that took me a little bit to get to there, but actually that helped because then it
Mm,
I came up with a plan for my body. And I
Yes.
wasn't wasting all this money on supplements or doing all these extra healing modalities that weren't necessary for me. So you really do learn a lot about your body. So I think that is a huge piece to it. It's just sad that it's not covered most places.
That's such a great point. And now, like that you brought that up, I did see a functional medicine doctor right after treatment, which I like somehow this just like totally went out of my mind. I forgot that because I was in that phase of like, I don't understand what to eat. I don't understand what to do. And we did do similar to the girl you were mentioning. It was a recommended doctor by my healthcare system. So it was in
Amazing.
network, which was amazing. And we actually even had at our cancer care center, it wasn't covered by insurance, but it was free acupuncture, free massage for cancer patients for a certain amount of, here's 3 sessions during chemotherapy or something, which was amazing. So I love your approach of like, start with a functional medicine doctor, start with someone that is going to look more at the holistic picture, and then start to break down like, what are the needs for you? Because I do agree with you in like overcorrecting can be overwhelming, right? Like, you
Completely.
finish treatment, you will start seeing so much online. You're no longer being watched, kind of. I don't want that to be a negative term, but like it's actually positive. Like you want to be watched. You want
Yes.
somebody checking on you all the time. So now that you're not being kind of watched like a hawk, you kind of are more susceptible to, well, what about this? Should I be doing this? Should I be taking this supplement? And it can feel a little targeting. So I love that idea of like, let me go get some lab work done. Let me figure out what my body needs and then kind of go from there. That's
Yeah,
so
and it's
important.
and it's also temporary. Like when we look at this cost, we're like, "Oh, it's so expensive." Well, it's a temporary situation where you're going to learn a lot about your body. Maybe you'll see them every once in a while, like and run some more labs, but it's not something you're doing consistently. And I also think, like you said, when I was throwing everything at it, I was doing all the things. I was fearful of nutrition or food. I was like living in this
Yeah.
cancer bubble and I wasn't living. And I feel like there has to be balance to it because you also have to do the things that you enjoy and they're not perfect. You know,
Yes.
none of us
My
have any
gosh.
idea what's going to,
Absolutely.
yeah, we don't know what's going to happen. None of us do. None of us. And so you
Yeah.
also need to enjoy your life as well. And I think like
Yes.
by having some of these tools, it helps. Oh, I want to talk about bone health a little bit because that's a big one that I think even myself I thought there's no way I'm going to have any issues. I exercise, I eat really healthy, I lift weights. There's no way. And, I was forced into menopause and then put on an aromatase inhibitor. And
Hmm.
at the 2-year mark, when you get the bone density scan, I was thrown into osteoporosis. Not pina.
Yeah.
What about you?
Just like
How
straight in.
I couldn't even believe it. It was it was
Gosh.
it was so defeating to me. It was one of those moments where, there's moments throughout a diagnosis where you think you have it, and then all of a sudden you're just like crushed and you're like, "What?" It was
Because
that
you
was
did all the things that you thought you could control, right? And that's the hard part is like to realize, like, wow, when we're on these medications, they are having an impact on our body. Like, I remember having a feeling like that actually when I had to go back on the medication after having my second son. And I remember it's like once you come off for a slight break, you realize what a big impact it has on your body and your mental health and all these things. Like, and I went back on. It's the right thing for me to do in terms of my risk reduction. But to your point, when it has such a difficult impact on you. It's really hard to wrap your head around that. So, in terms of bone health, similar to you, I thought I was like super healthy. I didn't really understand, I think, going into medical menopause and aromatase inhibitors, that this was something that we needed to worry about or even like fully understand. It was kind of just like, hey, this medication could have an impact on your bones. We're going to check in a couple years. And I only feel like, now after many, many years of checking in, I have a better understanding of like, oh, this is impacting the estrogen in your body, which is then impacting your bone density. And this is why we're checking X, Y, and Z. So after, I think similar to you, around the 2-year mark, 2.5-year mark, I entered osteopenia. So I was lucky enough to not go straight into osteoporosis, but at the time it was pretty high osteopenia. And so it was kind of, we're just going to monitor it, check next year, see how it's going, do some of the things for improving bone density, like you said, weightlifting. a load bearing exercise, right? Like doing some of the exercises. And then I think I also started just looking at my calcium lab levels and some things like that. And then a couple years following that, luckily for me, things started to go in a better direction. So I was still in osteopenia, but it seemed to be improving. And it's hard because people are like, well, what were you doing? And I'm like, I was doing all the things. So I don't really want to like put great, like magic thing on it. I was trying to do the weightlifting. I'm trying to do the load bearing exercise. I'm trying to eat calcium in my food too. I'm not taking a supplement.
Mm-hmm.
But I think those are some of the things, at least for me, that have been helpful to say, I can control X, Y, Z. I can't control what the medication is doing to my bones. But like
Yeah,
you said, there's some grief associated with that.
totally. So are you on a tamoxifen or aromatase inhibitor?
So I was on Lupron and aromatase inhibitor until my 5-year mark, which was now 2.5 years ago. So after I had my second son, I went back on, no, I didn't go back on the Lupron and aromatase inhibitor. I went to my oncologist and I said, I've hit the 5-year mark. Can I switch? And she felt very comfortable switching. So I'm now on tamoxifen. And I have noticed as well that, maybe that's playing into some of the improved bone health as well because of that shift. So
Yeah.
that was kind of her thinking, was she felt very comfortable after 5 years to switch to something that, you're no longer doing the ovarian suppression.
Yeah. And
So
I
that's
did
been about two and
hear
a half years.
if you are the tamoxifen can help with bones, which is nice. So that is good. I was able to reverse mine a little bit. I can't
Amazing.
wait to find or get my second one, which I think is in October or,
Okay.
a year later. I'm really curious where I'm at now, because a year ago when they saw how bad, they said they'd never seen such a rapid decline and they wanted me to go on bone meds.
Yeah.
Everybody has a personal decision. I was like, I need to jump off this hamster wheel for just a little bit. I took a break of the aromatase inhibitor. I'm like, I just need to try things on my own. Not Doctors were not happy about it. I never
Yeah.
recommend this to anybody.
Yeah.
Everybody's like, what's your story with it? I'm like, we're all unique. Okay. Do not take my story. And I'm taking
Yeah.
a risk. I think you have to weigh your risk. Like but my bones were so bad. I needed to do something. So,
Yeah.
but I learned a lot too about nutrition. I do always, I think, in nutrition first as well,
Yeah.
along with the weightlifting, but like prunes are so good for us and tahini, it's so good for
Mhm.
us, and leafy greens and all those things are just so good. But I had to do things a little bit differently. So I did do things differently from when I was diagnosed, but I also took a break on that. And I'm
Yeah.
not back yet. And I don't know what I'm going to do. I don't know what I'm going to do.
Yeah, that's a hard decision. And I love that you said, like, don't take my advice for it. Like, that is a risk. But that was the right thing for you right now. I mean, I think you do have to look at your health and say, like, what are the risk rewards? Right
Mhm.
now you're focusing on the bone health, and then you'll figure out what to do, right? And so I think that's like, you just have to do what's right for you and kind of consult your care team and yourself and your partner and everybody, and figure out what's best for you in that moment.
Yeah, this is definitely not medical advice ever. Always talk to your doctor. We are all unique. I'm like, don't take my story, because I would never, I see people on social media like saying, this is the one way to do it. Like, don't do this because this causes this. And I'm like, wow, why would you want that on your shoulders?
Yes.
Like
Yes.
what if I
And
told somebody not to get a mammogram and they didn't get it, and then
yeah,
all of a sudden it was like, I don't want that on my shoulders.
yeah,
And a mammogram saved my life. Like, people ask me, like, aren't you worried?
exactly.
No, I'm not worried, because I'm worried if I don't catch it in time. That's what I'm always like,
Exactly.
this is my journey. This is you do you.
That's such a good way to put it. And I think also just realizing that I was talking to someone recently, we were just talking about breast cancer in young women and just like breast cancer as a whole. And that a lot of people don't realize that breast cancer is kind of just a term to encompass hundreds of different types of breast cancer. So I think we think like, oh, it's this homogeneous group of cancer, but it's not at all. Like, everyone's scenario, down to, the size of your tumor, the receptors it has, like how you handled treatment, what kind of surgery you had. Like, there are hundreds of variables and you put that
Hundreds.
towards millions of people, I think you're right. We are here sharing a story, a lived experience. I like to say, this is my lived experience with cancer. Take from it what you will that is positive, whether that's hope or whether that's questions to bring to your doctor. Maybe you're going to leave this conversation and say, wow, I didn't know that I should be getting scanned for my bone density if I'm on an aromatase inhibitor or a hormone blocking medication. Great, go to your doctor and have that conversation. But don't take anything that you hear online, whether it's from us or someone that's claiming to be an expert, don't take that for fact, right? Because your situation is so unique. So I love that you touched on that. That's
Yes,
so
yes, yes.
important.
And even like, somebody will say, how did you handle radiation? Well, we all handle it differently. How did you handle letrozole? Well, this is my journey, but my really good friend handled it really well. Like our
Yeah.
bodies respond to the medications so differently. It is wild. I had a really good girlfriend who went through radiation. She crushed it. She never got tired. I got tired. I had
Wow.
somebody
Yeah.
who rocked chemotherapy and somebody else didn't. Like we are all so unique. And so just
So
remember,
true.
yeah, we're all different. By the way, speaking of, did you by any chance do a vaginal estrogen? Do you take, or do you open
I
to
did
ask about that?
not. No.
Okay.
Oh, I mean, definitely go ahead. It's definitely something that's been interesting because I just hit this 10-year mark, and I think there's been so much progress in terms of just talking about vaginal solutions when it comes to like the impacts of breast cancer treatment. And so when I was first diagnosed, I had gone to a gynecological pain specialist because I was having like, essentially my tissue was very dry and deteriorating from the lack of estrogen. And I ended up using like dilators and lubricants and even like a topical lidocaine, which at the time were like kind of the common interventions. And so it's so exciting now to see vaginal estrogen being approved and all of these other advancements in terms of women just having more options for the painful
Thank
side
you.
effects of cancer. It makes me so happy. But I luckily, when I switched to tamoxifen, all of my sexual side effects literally disappeared overnight. So it just was shocking and also a reminder of how intensely these medications impact our body. So that's just
It's
like
wild.
crushing
Yeah,
sometimes.
it is wild. But I'm glad we brought this up too. It wasn't even something we are going to talk about, but that is part of survivorship. Women are so alone. They're like, wait a minute, totally dry. I have no desire. It hurts. It's like, how do we navigate that? And some women aren't comfortable talking to their spouses. Like I was very open and honest with Darren. I was like, hey, this is how I'm feeling. This is not you. This
Yeah.
is me. And we need to figure this out. And then I did go to a gynecologist and I was open and honest about everything. And she did share with me all before because she had suggested vaginal estrogen. I wasn't there. I didn't do
Yeah.
that for like 2 years because I was like, wait, I'm scared. And,
Yeah.
we know now it is, again, talk to your doctor.
Yeah.
Of course, there's always a risk to everything, but it is a safer option than what we thought it used to be. And it has helped immensely with bladder issues and dryness and all those things. But still, even the intimacy piece of it, because we're stripped of estrogen, we don't have that desire. So you need to talk
I
to your doctor.
know.
But there are things that you can do. There are things you can do. And so just don't think that this is just how life is going to be now. You can navigate this phase of it.
I love that you mentioned that too, because I think like me and my husband have gone through phases as well too, and we're both in a phase where we need to revisit it because we have two young kids and we're not making as much time for each other and intimacy. And so this conversation is reminding me like there are some things that I want to just revisit in terms of, the intimacy is not there as much as I would like because of the lack of desire too. So while I've now addressed the pain piece, it's just
The desire, it's
like
just
the
not there.
desire is not there and I hate it. And like me and Mac have open conversations about like, hey, how are you feeling about this? How am I feeling about this? There's also the mood piece to it of like you've got the estrogen and then, dealing with anxiety and depression. So it's like there's so many layers to it. But just a reminder, like you said, that there are resources out there. Don't feel like this is the best I'm gonna do. this is the best situation, and just kind of give up. So I think that I'm so glad you mentioned that. Just a reminder for
And it
everybody.
evolves and it changes. Like, that's in a marriage without a diagnosis.
Yes.
Sometimes you have to learn to date again. Sometimes you've got to like have those conversations, like just to be open, like how you're feeling. Sometimes you need therapy. Sometimes, there's just so many things that we can do to help with that. But know that you're not alone. There's a whole bunch of us. I think even explaining kind of like what you just said is the science behind it. We have no
Yeah.
desire because we have no estrogen. We're like basically children. You know what I mean? Like
Yes.
it's
Yeah.
wild what happens to us. So like when they understand that, they're like, oh, it's not me. It's literally what's happening in my body right now.
And then it takes away some of the shame. And I
Yes.
don't know if shame's the right word, or guilt, or like a shouldn't I be desiring my partner, or shouldn't I be wanting this? What's wrong with me type of thing. And I think that's something over the years of just like, like you said, better understanding the science and better understanding like the implications of that in a real life scenario, so that you can say like you said, this is the estrogen. This is the lack of estrogen. Something's wrong with me. Nothing's like, I'm not doing anything wrong. This isn't a failure of my relationship or anything like that. This is just women go through this. And also realizing like women that are going through menopause or perimenopause, like these are very similar experiences. It's just for a lot of us that have been diagnosed at a young age, we're going through it sooner. And we're also not maybe prepared for it because we haven't been adequately educated to understand what is medical menopause. What does this mean? What are the implications of the medicine?
Yeah. I love it. Oh my gosh, I'm so glad
Yeah,
this conversation came up today.
me
I want to
too.
talk about GLP-1s because everybody in
Yes,
the
me too.
world is talking about it. So I remember I heard about this on a podcast, actually my girlfriend's podcast. She interviewed Dr. Tina Moore. And I
Okay.
was so intrigued. I was like, wait, what? What is this microdosing? And she kept talking about how the microdosing, not for weight loss, but for longevity, for brain, cardiovascular, and bone health.
Interesting.
And I was like, okay, the fear that I have after breast cancer and the lack of estrogen is my heart health, is my brain
Hmm.
health, is my bone health. And wait, this simply taking a very, very, very tiny baby dose could actually help with that. And I was so
That's so
excited.
interesting.
So I
Yeah. So
started
how did you?
microdosing.
You did. Okay. And did you have a positive experience? Like, who did you go through? Did you go through your doctor, or like because I know that is like in different parts of the country, different people, different doctors in areas are treating it kind of differently.
Yeah, this is 100%. If you have gone through breast cancer, I think you need to go through your doctor. And this I got from my functional doctor. And because I feel like we have to be monitored. I mean, I know there's telehealth companies out there that are doing this, but I think, the one thing that scares me about some of the telehealth companies is just that there's so many other injectables within these companies. And if you just think, okay, well, I'm going to microdose this GLP-1. Oh, and I'm going to try this BPI or something. There's other names. Oh, I'm going to try
Okay.
this one too. Well, wait, that's not good for somebody that's with breast cancer. I just really
So
think
then
if
how
you
do you know that? Yeah.
correct, I really just think you should most like have your doctor involved. And so you don't
I 100% agree. Yeah, I'm all for like the monitoring, making sure you're going through like a channel of something that feels, and not that like an online healthcare system cannot be legitimate,
correct.
but it's just like you said, it's this added layer of someone that better understands your experience, your needs, contraindications, should you be on any medications or anything like that. I think that's so, so important
I think so
just to kind of
too.
better understand.
I think so too. Just so I always want to say, just be cautious. And again, I'm doing this. It doesn't mean that this is the right for you. You need to talk to your doctor. My doctor, we did so much testing before I said, "What do you think?" She's like, "Let's try it out." And I take such a small dose. What it has done, what I've noticed is it definitely helps with my brain health. I just noticed that I'm just more clear-headed. It's increased my happiness. I've definitely got rid of food noise. I think I've always had food noise. Like I could snack all day, every day.
Same. Yes.
And so it got rid of that food noise. And, we do gain just a little bit of belly fat or whatever. Or sometimes people have that's the other frustrating thing. These hormone blocking meds can cause weight gain and you can do
Yes.
everything and it's not helping. And so I had a little bit of weight gain, just a little bit. And so I think that kind of helps with that extra 5 pounds. But I don't really notice anything other than what it's doing, I hope, like with my brain and heart and bone health.
Yeah, more preventative, like you said. Yeah, I think, for me, I mean, I have to like fully admit, I was super, super against GLP-1s, like just for quite a while, because I think, I gained a lot of weight during chemotherapy. Like, I mean, I say a lot of weight. I gained like about 10 pounds, which on a small person feels like a lot. And I've just like struggled with kind of food and dieting and this like skinny culture for a really long time. And so post cancer, I really have tried, like just in the past couple of years, even since my second son, my body looked different. I weighed a different amount, just trying to get to a better place of acceptance for my body changing. And I had done that work. So I think I was being judgmental, about the GLP-1s. I was seeing it as just like, why is everybody doing this? Like, it just feels like it's being pushed on people, feeling like it was. And I still am against that. I still am against anyone feeling pressured to take a GLP-1 or being shamed for their body or being told that they should take it because of their appearance. But
Yeah,
similar to you,
totally. And
right?
there's
Like,
so many people abusing this. There's so many people
yes,
doing it wrong. There's so many people doing it and they're not doing it in a healthy way. So no, I agree.
exactly.
There's still I had the same feeling and I think a lot of people do. Because
I
all of a
think you're
sudden
right. Yeah.
we were like I grew up in the fat-free phase where everything was fat-free and
Yes.
this up and down culture. And then all of a sudden the Kardashians came in and okay, we could have a fuller figure and feel good. And then all of a sudden now the skinny culture is coming back where you have to be super, super, super skinny. And it's like, wait, yeah,
You're like,
it's
how am
so
I supposed to keep up with these
right.
like expectations? And I think my girlfriend and I talk about that, like, even when you're doing the work on body acceptance, the reality is that the world around us still has these pressures about our appearance. And so you're constantly like the mental load of saying, like, okay, I'm fine as is, I'm fine as is, I'm fine as is. All those things is just so hard. But to your point, when I started really getting to the point of exploring a GLP-1 and kind of shifting my thinking, a couple of girlfriends had been on it and had a very positive experience. And I actually didn't even know that they were on it. And one of them had shared, oh, I literally work out all the time. I'm extremely fit and I just don't feel like I'm losing the weight. And so that spurred my thinking of really coming at it from, like you said, a long-term health benefits related to my body. So what I started with was like going to my doctor and saying, what is my lab work? What does my cholesterol look like? What is my A1C? What are my labs? And could there be a benefit to these pieces for me? Because post-cancer, you want to do everything you can to take care of your health. And I started thinking, if this is something I can control, I am on the tamoxifen. It's very clearly known to increase your weight. I felt like I'm eating healthy, I'm working out, and I keep gaining weight, which started to make me feel just a little bit scared about my overall health, less so about my appearance. I had gotten to a good place about that, but I start feeling like, wait, is my cholesterol going to keep going up? Like what's going on here? And so I started on like the lowest. I'm not microdosing. I am on a full dose, but I started 2.5 milligram in August, and I just like have been so thrilled. I felt so great on it. And I think, obviously we're having this conversation here, which is wonderful. I want to talk about it more as it relates to making a health decision about your long-term health and less about like how much weight am I losing and appearance. Because you and I both are focusing on it for a very different reason, I think.
Completely. But I'm glad you brought it up because it's not about for everybody else and wanting to feel skinny or looking whatever.
Yeah.
Excess weight is a risk for breast cancer. It's a risk for
Yes.
recurrence. So that is another factor in kind of what you're saying to get the weight off. I mean, it's not to be perfect because listen, nobody's perfect.
Nobody
And I
is.
think there's
Yeah.
a lot of people who are getting way too skinny on this, way too fast. I think it's low and slow, like you starting in the main, the starting dose is fine too. A lot of people start there and
Hmm.
they just don't go up from there. Or some do, like
Yeah.
depending on how you feel. How are you? Okay, you've only been on it then like,
So like I'm about to take my 8th week
uh-huh.
today. I forgot to take it last night. So I'm still like very early, in the long-term process, because I think at least with my doctor, she was like, let's give it a year, just with the slow and steady approach. I think
Good.
where I have heard very negative experiences or bad side effects is really the people that go fast, that they don't have a care provider checking in on them or providing accurate guidance, or they're not eating and moving enough to have any energy, and then in which case then they're just losing weight too fast and it's having negative effects on them. So for me, I've been almost 2 months now on the 2.5. I think I am going to go up next month just because the last week or so, I've started to notice that like it's not having the same effects on me in terms of like the food noise and just like overall kind of hunger and just impact. But honestly, like I've had such a good experience. I haven't really had a lot of like nausea or issues or side effects. And like you said, I just wake up feeling better, which,
Good.
like survivorship, right? Like I think we also get used to like waking up and feeling crappy, like especially, your feelings and your aches and this and your bloating and just like all of the feelings. And so it's also felt just like really positive to do something for me and for my health that felt like it was like based on labs, based on evidence, and be able to track something and say, I'm doing something in a way that I can maintain long term. Because I don't hope to be on it long term. I hope that like I can get to a good place and continue that work, with the working out and the eating and all of these healthy lifestyle things that I know you and I are both
Yeah,
focused on.
absolutely. And maybe, I mean, who knows what's going to come out, but maybe you get to a place where you've got everything going, but you still take a droplet every once in a
Yeah.
while. And I
Right?
think too, there has to be breaks on it as well. I've done so much research on it, but I'm so excited for the cardiovascular piece. Like
Yes.
so it
Right.
and the Alzheimer's, like there are studies coming out. It is wild how
That is
beneficial.
so interesting, right? Because again, yeah, I think like we were just saying, like I was so skeptical of it because of this appearance related thing. But yeah, when you get down to it, you start seeing all of these benefits. So to your point, yeah, maybe I get to a good place, in terms of weight, and then it's this microdosing.
And you
And
don't
that's
even
so
notice it.
interesting.
You don't even
Isn't
notice
that
it, but
so
it's just
interesting?
right? I know. Listen, it's wild, all the things. There's so many things coming up. There's something, I mean, I've interviewed a lot of people on this podcast. I mean, there are
Yeah.
nicotine patches that are coming back that could be helpful against like brain cancer. And I mean, it's wild. That was on a previous show that I just had with
Wow, I'm gonna
our
have to
doctor
check
on.
that out because I
But
am
yeah,
I am so curious, and I think the rate in which we're seeing new developments, like just in the medical world, is insane right now. And I think like the flip side of that is that it can be kind of confusing to keep up with because you're
so
like, wait,
confusing.
last year this wasn't recommended, or last year
I
this
know.
wasn't even out. And now there's like new studies coming out, which again, back to the big point we were talking about at the beginning is this is my lived experience. This is your lived experience. Now go talk to a functional doctor or your trusted oncologist or whoever it is in your life and decide, is this the best option for you? But it is so exciting. I mean, in the breast cancer space, in the health space overall, in the cancer space, just to be seeing these developments of like, wow, we can actually make some big progress and impact on people's lives. That feels huge.
It's the repurposing of drugs too, which is so wild. I listened to this
Hmm.
one, I'll share it with you. There's this one episode where it is wild. I'm like, wait, what? This drug is for this thing. And now they're learning that if you microdose it, you take it a different way. Like, it's the same thing with GLP-1s. Like,
Yes.
This was for diabetes, and now it can help with pain. That's one thing that I noticed too. I, was dealing with some back issues and people who are on hormone blocking meds and they deal with the joint and bone pain. Actually, Dr. Tina Moore, the reason why she started microdosing for her patients was for pain. That's why she
Wow. Okay.
yeah. So she's a good one. I'll share that info. She's a
Yeah,
great
share
one.
her with
She's
me too.
so smart of because you're going to be even more excited about why you're doing this is
Yeah.
the benefits are wild that are coming out for cancer and everything. So it's
Oh
really
my
exciting.
gosh. Oh,
Let's talk about, okay, you're at 10 years, right?
yes.
Okay, so
Yes.
have you, because we know anybody that's newly listening, you've dealt with anxiety and fear and PTSD and, worried about appointments. Like, how do you still have it 10 years later? And if so, what do you do to help with the fear and anxiety that comes up
Mhm.
with the diagnosis or the aftermath?
And I was just talking about this on a panel that's going to come out in October soon for this TV episode. But I think it's interesting. I think it evolves. So at the beginning, that fear is very visceral in the sense that like you feel it all the time. It's overwhelming. It's like in your body to the point that, it feels controlling. And I think now at 10 years, I don't want to say that there's a magic pill and you hit 10 years and suddenly like your fear disappears. I know you recently walked in the Anna Ono Cancerland,
Amazing.
fashion show, which was phenomenal, but like bringing attention to the fact that metastatic breast cancer is still a challenge. Still need to be we need to get more research for it. Like the fear of the potential of a rediagnosis or a metastatic diagnosis is still there. But I think what shifted for me is one, better understanding what is available should you be re-diagnosed. So, like being more educated on treatment options, seeing women thrive with MBC, right? Seeing them it feeling less like this scary unknown and more like, oh, I have friends that are living this. Like, should this happen to me, I have a better sense of what it could look like. And it's not the end of the world, right? It would be a setback, but it's not the end of the world. And then I think the third piece is just that your feelings and thoughts around cancer and the role it plays in your life move to the back seat a little bit more. Now it pops up every once in a while if there's a trigger or if, something's going on in the world that brings it back up, but it's less visceral in the sense that like every day I don't wake up thinking about a cancer recurrence. Whereas, maybe at year 1 or 2, I did. And so I think that hopefully can bring some hope that like it truly does just take a little bit of time to get to a place where you can feel a little bit more at peace with what the future may hold.
Yeah, I love that. It is true. It gets easier over time for sure. Gosh, I remember the first 6 months, the fear. Why does it always wake you up in the middle of the night? Like, so rude.
Yes.
Like, we need sleep, like, sleep, and then all of a sudden, it's like I think it's because 'cause we're so busy during the day, and then all of a sudden, in the
Yeah,
middle of the night, it's like, "Hi, I'm awake, and guess what? Reminder, you have cancer." And you're like, "Thanks a lot."
exactly. It is, and I think sometimes it still wakes me up, right? But it's usually more pointed, like something specific versus just like this overarching fear. And I think too, then, every year I try to tell people like celebrate every milestone because every year is another year under your belt that you don't have a recurrence, that you're healthy, that you're thriving. And so I try to tell people like, don't wait for this big moment to live your life. Like just live your life along the way. And then you now have this evidence of thriving, of being like, wow, yeah, I'm living beyond this cancer. And that then also I think helps you with the fear piece.
It really does, and I mean, I think too, a couple things. Number 1, spirituality really helped me. Becoming just
Mm,
more spiritual and not fear of what could happen, because guess what? That's the one guarantee in life. Like, none of us are
yeah,
getting out of it alive, and so when you have peace with that, and then you also are like, "Okay, like, today's a new day, and I'm home, and I'm doing good, and, like, I'm gonna enjoy it. I'm not gonna worry because wouldn't it suck if like 5 years down the road, nothing's come up, but you wasted all these 5 years worrying and
Yes.
fear? Like, why
Yes.
not go live it? I mean, we just truly have no idea, and just appreciating. I think the thing about a diagnosis, and this was for me, I'm wondering if it's for you too. I was like, wow, I never noticed the world I live in. Like, I never had
Mhm.
looked at the trees and the sun and the moon, and like everything is just so, it's just more beautiful and more impactful. And I think that's a gift that or a blessing that we get from a diagnosis. And you just have to appreciate those things and be grateful, even during the hardest days, finding something to be grateful for, like a cup of coffee. We were talking about when we first hopped on how much we
Yes,
love coffee.
exactly.
Like, just those things can just make you feel better.
Absolutely agree.
Yeah.
Absolutely. Yeah.
Yes. So is there something for you that, like, looking at it, what is, I always ask, and we're at the end now, unless there's anything else that you can think of. Of course, I'm going to
Yeah.
have all of Anna's stuff in the show notes below where you can reach out to her. You have to follow her on Instagram. She's incredible and so fun to watch. And I was like wanting to be with you in Paris when you just did that trip. I was so jealous of
Gosh.
every
Yeah.
moment. And she's just fun to watch, and anything. And then she's got in her Instagram, and I don't know if you have a website too. Do you?
I do. Yes.
Okay.
I have my blog, which, it's like I haven't been writing as much lately, but I have essentially like 7 years of blog content covering every cancer thing, mastectomy, chemotherapy, all the tips and tricks. So, yes, it's mycancerchic.com. So we can put it
In the
in
show
there as
notes.
well.
Okay, good.
Yeah, that will be
And
wonderful.
and then in her Instagram account, like if you go to her bio, there's a link tree that will take you to, like, if you are about to go and have a double mastectomy or whatever, like she's got all the things that you need for that, which is, that's a gift alone. Like, somebody that's like, I don't even know what to do. I don't even know what to buy. She has it all with this Amazon storefront to tell you things that you need. And it's like
All
perfect.
the things,
All
yes.
the things.
Hopefully helping it, making it a little less, a little more easier, a little easier. Wow, I can't talk. Hopefully helping make it a little easier to navigate, those really difficult times.
Yeah. Absolutely. Okay, so before we end, what is something that has, like, from the craziness of a
Mm.
diagnosis, what is a blessing that you can say has come from it?
Gosh, I mean, I think this right here is evidence of it, the community. And I know, like, to some people, it's like, well, what does community mean, right? Because you may be at the beginning trying to figure out who your community, who your tribe is. But for me, I really just had such a blessing of meeting these amazing people, Jen, like you, like so many of the shared friends that we have in this community, advocates, just being able to connect with people around the world. Not just, our country and my state, but around the world that have some shared experience with breast cancer, with trauma. I think that it does bring you together and allows us to find inspiration and hope in so many different experiences, so many different lived experiences. And so I just feel so grateful that I have that community and have been able to connect with people. That fills up my cup, being able to connect with other people just as much as it is fulfilling for me to share and help others. So I think that's truly just been the biggest gift for me.
It it really is. The women that have come into my life because of this diagnosis, it's wild. And that is definitely one of my gifts too. Like, it's wild. Like, meeting you, you're incredible. Like, when I went to New York Fashion Week, and I know you've attended events, like these women that
Yes,
we see online, and then all of a sudden we're all together. And when if it's something about breast cancer, when you've gone through
it
breast
is.
cancer, there's an immediate connection with that other person. We just, like, you just get each other.
It is. It's so special. And I think, I've talked to a lot of people about it. I think there is something so powerful in not having to explain and give context for your lived experience. And breast cancer, is just one of those things that it's so nuanced. I mean, we've talked about this throughout the whole experience, but the whole chat today, but this, like, not having to explain any of that. Like
I
walking
know.
into a room and saying, great, you're XYZ. Blah, blah, blah. Okay, one sentence. Great, we're connected. Let's talk about XYZ. Like, then we could just dive in deep. We just had somebody over for a play date yesterday. Now, granted, we were talking infertility versus breast cancer, but similar thing where it was like, we literally just met each other for the first time. Our kids are new friends. And we were just like, dive right in. What's your infertility story? Tell me everything. And my husband's like, wow, we went there fast. I'm like, yeah, because once you have that connection, you just have that connection and you can go deep. And it's just so much more fulfilling.
Oh my gosh. I think this episode was amazing. People are just going to love you and this conversation. So I will have everything in the show notes below. Thank you so much for being here.
But thank you for having me. It was so much fun.
Yeah. And